Welcome to Muscle Research Review for the week of May the 4th, 2015. Quick research summaries for the very busy health and fitness professional. So let's begin. If you ever get the question from your patient and client, am I going to get arthritis after my ACL injury? This study provides some insights into the answer. More specifically, is there a difference in osteoarthritis progression between those that undergo ACL reconstruction with hamstring tendon graft and those treated with conservative management? Now, 32 people were split into two groups and followed over 10 years. The ACL reconstruction group actually had a better functional outcome and laxity measurements. However, incidence of radiological osteoarthritis was similar between the two groups. Bone bruises was also not found to be risk factors for development of arthritis after ACL rupture. Surgery may be the better option, but the progression of arthritis is similar. If you treat or train someone with chronic low back pain, you probably look for and address movement coordination impairments. Now, perhaps you use stabilization exercises as a treatment strategy. But what about acute low back pain? A new study found that acute and subacute low back pain patients demonstrated decreased trunk motor control, suggesting impairments in proprioception, motor control, or central processing early in the back pain episode. Now that means the deficits were not associated with pain or fear of movement. That may mean reevaluating treatment strategies for acute back pain patients or clients and implementing certain exercises earlier than before. What do you think? Is this something that may make you begin adding different exercises to address these deficits a lot faster? A great new systematic review just came out on clinical outcomes for posterior instability of the shoulder. Now, this summary of findings is a great overview of the education you can provide your patient or client if they present with posterior instability. Out of 1,035 publications, 53 studies met inclusion criteria. Here's a summary of the key points to remember. Well-defined shoulder outcome measures to assess posterior shoulder instability are lacking. Now, arthroscopic procedures are shown to be effective and a reliable treatment for unidirectional posterior glenohumeral instability with respect to outcome scores, patient satisfaction, and return to play. Also, arthroscopic procedures all showed superior outcomes in these parameters compared to open procedures. For the likelihood of returning to pre-injury level of sport, it was found that the throwing athletes were less likely compared to contact athletes or overall athletic population, even though they had similar outcome measures. Does taking a sitting break from prolonged standing affect recovery from low back pain? A new study actually says no. Now, 20 participants participated in 45 minutes of standing and 15 minutes of sitting. Now, 55% reported low back pain in standing. The sitting did not provide lasting recovery of low back pain for the pain developers. The study found that the pain producers used a limited range of their lumbar spine angle and increased thoracic extension. 15 minutes of sitting didn't change this. If you have patients or clients that can get back pain from standing, frequent seated breaks may not be the best strategy. I actually often just address spinal mobility and back endurance through an exercise program. What sort of strategy do you use? If you have any comments, leave them below. Also, make sure you subscribe to our YouTube channel for the latest updates. See you guys next time.